Do you have a child that suffers with eczema? Multiple mothers from the functional medicine Charlotte community have reached out to me and said, please do a video on childhood eczema and what causes it and what you can do about it. I'm Dr. John Bartemus, and I'm putting the pieces together to help you live a life at optimal. When looking at eczema, the conventional management of eczema many times is hydrocortisone topicals or doing bleach baths or things of that nature, all focused at addressing the skin. But what they don't ask is what is an underlying driver of the skin reaction. Eczema oftentimes is an immune reaction in the skin, but we have to remember that 70 to 80% of the immune system resides in the gut. So if we're having skin issues, we want to ask the question, what's going on with the immune system? And specifically, is there a gut issue driving immune dysfunction resulting in skin issues? And this is called the gut-skin axis. So if your child has eczema, there's a lot of questions I would want to ask you. For example, was your child a C-section birth? If so, then they didn't pass through the vaginal canal and get that first inhaled dose of mom's vaginal flora. And those flora are there to help seed the baby's immune system and the gut microbiome. So if they never took that crucial breath of mom's vaginal flora and mom's feces, then they didn't seed their gut and immune system properly. Conventional medicine and mainstream are starting to realize the importance of this, and so some hospitals that are forward thinking and ahead of the curve have started to swab moms' vaginal secretions for the C-section babies and kind of pat the mouth and nasal passages so that they seed the immune system, so that kids, even though born by C-section, have a shot at developing an optimal immune system as naturally or as close to naturally as they would have if they were born vaginally. So C-section births, that's a big deal. The next question would be, was the baby breastfed? If the baby was not breastfed, if the baby was given formula, then they're immediately given pro-inflammatory, I guess we can call it food, from the start. So many formulas have soy, have corn, have high fructose corn syrup, have pro-inflammatory antigens in them that immediately are starting that baby off in an inflamed state or tipping towards an inflamed state, which can lead to leaky gut, which can fire up the immune system, which can lead to eczema via gut-skin axis mechanisms. Next question would be, is the baby fully vaccinated? Vaccines have tons of antigens and allergens in them. So vaccines can drive a pro-inflammatory state, can trash the gut, can lead to skin issues. So those are three major issues you want to ask. Also, how's the baby's stool function? So has the baby been constipated lifelong, or has the baby had diarrhea lifelong? Was the baby colicky? All of these things are clues to potential issues with the gut that then results in skin issues. So these are just some of the questions to ask. We could go down the rabbit hole for a long time, but these are some major ones to consider. And even if you're breastfeeding, even if the baby was breastfed, then think about what was mom's diet like while breastfeeding. Is it full of gluten and wheat? Is it full of corn and soy and high fructose corn syrup? And dietary antigens that not only inflame mom, but then can inflame baby. So we want to ask those questions, and depending on the answers to those questions, we would chase it down further. But the ultimate overarching thing you want to look at in an eczema case or a psoriasis case of kids this young is what's going on with the gut and how is that impacting the immune system, which results in this person in skin symptoms, but where the symptoms are isn't always where the cause is, and often isn't where the cause is. So the analogy is like a crime scene. So the symptoms would be the victim, right, screaming out for help. But by the time the police get to the victim, the cause or the perpetrator is far away. So if the skin is the victim crying out, oftentimes the cause or the perpetrator or the person at fault is the gut, which can be far away from the skin. So from a functional medicine perspective, we want to look at the whole person. Eczema can be caused by other things besides a gut cause. So again, we want to assess the whole individual in front of us, and one individual's puzzle is going to look different than another's, but a great starting point and an area often part of the problem is the gut and the immune system.